Hi, everyone, and welcome to the Office Administration Health Services Program, S135 Program Information Session. Thank you so much for joining me today. My name is Mary Simmons, and I am a professor in the program as well as the program coordinator. And again, that is the name of our program, Office Administration, Health Services, and our program code, S135. So this program, Office Administration, is designed for those who want to enter a helping profession in the healthcare environment. And this would be in an administrative format. Your role is ever evolving, and you will be doing things that are administrative, but also some clinical activities as well. This program really teaches you how to effectively help patients and clients, and actually the general public when they're coming into a healthcare facility. And this will be both through interpersonal, your soft skills, which are so vitally important, and also your technical skills. And you learn both of these, quite a lot of them, in this program. So the courses are all taught by very highly experienced full-time and part-time faculty. Some of our faculty have been with us for quite a long period of time, and others are a little bit newer. But each of us brings our own knowledge and our experience and expertise into the courses that we teach to our students. There's a real variety of teaching techniques that are used and methods. So there's lectures, there's in-class activities where students are broken up into smaller groups. There could be just full classroom discussions that are going on, and of course the group work. And then there'll be introduction to healthcare software. That usually happens in the third and fourth semester. Now, just wanted to make a little addition to what I was planning on saying. You might be watching this while we are still teaching virtually at George Brown College due to the pandemic. So of course, right now, all of our classes are being taught virtually online. But that does not take away from the learning experience. We are still actively involved, having online virtual classrooms with all of our students and combining all of the teaching techniques and methods that I have just mentioned. Then from there, upon graduation, we are hoping that you will be very prepared to work within a variety of healthcare facilities. So the program basics. So the credential that you will receive upon graduation will be an Ontario College diploma. And the delivery of this program, it is taught in full-time. There is no part-time, so full-time. The duration of it is for 2 years, and there are 4 semesters. So let me just explain that a little bit. In our program, we have 2 student intakes. There is the fall intake, where students will start their first semester in September. They go from September to December, have a break, then they come back in January, and they go until sometime in April. And then they are off for the entire summer. Then they will come back in the following fall to resume their 3rd semester, and then of course from there, their 4th semester, and then on to graduation. The second intake, we have students that start this program in January. So they would have their first semester in January until April. Their second semester would start in May until sometime in August. And then their 3rd semester would start in the fall. So in a sense, they would be joining, or they are joining, the other intake that began back in the fall. And then they would too continue through until their 4th semester the following spring. And then everybody hopefully will graduate at the exact same time. So there's the 2 intakes, fall and winter. The one big difference I would say about them would be that fall generally has many more students that are starting at that time, and the winter intake does seem to be a smaller amount of students. Otherwise, it's exactly the same, except for the winter intake. They are learning throughout the entire summer. So there's no summers off for that intake. In this program, we gladly welcome, of course, domestic students and international students. We have people from all over the world that have come to this program and successfully graduated. And that's just one part of why George Brown is such a fabulous college to come, because we have people from everywhere coming together to learn together. So admission requirements. So applicants must have an Ontario Secondary School Diploma. You need to have grade 12 English, and you need to have, or we certainly do hope you have, a good basic knowledge of keyboarding. And I will talk a little bit more about that in a few moments. So success in the program. So of course, we are definitely here as teachers to help you with that success. We want you to have a comfort, a familiarity with technology, and many of you do, whether it's on your own home computers, your tablets, your telephones, whatever it may be, could be previous work experience or school experience, but any kind of familiarity is highly recommended. Students in this program will learn the Microsoft Office suite. They will also have access to some hospital software to practice on that, and billing software. And they will also learn Access, which is a database software program. So you'll have a lot of exposure to technology. Having really good time management and study skills is going to be extremely beneficial to you to help you succeed in your journey through this 2-year program. We offer a student success program for the first year students, and it's designed to increase success within the program. And I'll talk a bit more about that as well in a moment. And I just want to mention, and I'll mention this again, that faculty in this program are very much of the belief that we have an open door policy. So that means if there's anything going on, any concerns that you may have with your courses, you're not understanding something, you feel you might be falling behind, whatever that may be, we strongly, strongly encourage an open door policy. So please feel free to reach out to us. We're very easy to get a hold of. We're an email away. And of course, if this is in-person studies, then of course you're going to be seeing us and you can talk to us as well. So success in this program, a few more things I wanted to mention to you. There are many, many student resources at George Brown College that are set up for you and easily accessible for you as you begin your first semester in this program. So some of the things that we offer, we have learning groups and we have drop-ins. There's actually, on the learning platform that we utilize called Blackboard, there is a hub that is set up for this program. And this is where lots of information is posted and where lots of groups get together and talk about different things in this program and to help each other, as well as other things that are going on within the college. We also have student success email series. We have one-to-one consultations, in-class workshops, learning and time management tools and tip sheets. There's also a self-referral form and early alert. And just to mention a bit more about that, again, if students are having any issues as they begin this program, we really encourage you to reach out earlier than later. We are here to help and we want you to be successful. And then there's lots of tips about information regarding guides to professional success in the program. And those are just some of the tools. There are many other resources that are also available at George Brown College to all of the students. So the coursework, it's taught both online, right now at least, and of course at the Daphne Cockwell Center for Health Sciences, which is at the Waterfront campus. And I'm not sure if any of you have come down and taken a look at the campus, if you've had the opportunity to come into the campus at any point in the past, but it is a beautiful, beautiful campus right on Lake Ontario. And we are located right at the bottom of Sherbourne. We are easily accessible from both Union Station, Sherbourne Station, and also Pape Station. And it's a beautiful building that's been around, I think now for, around 8, going on maybe coming up 9 years. And it's just a lovely space, and it's fully dedicated to all of the health science programs. So in our program, classes can begin as early as 8 a.m. So we always make sure we let students know that it's an early start, and they can finish as late as 6 p.m. So those are time frames to make sure that you are considering when you are thinking about coming to our program. There's approximately 18 hours of class per week, and classes can either be 2 hours in length or 3 hours in length. And of course, your teachers will give you, if they're 3 hours, they'll probably give you a little bit of a break in between just to maybe stretch, step away from your computer. If it's in-person classes, have time just to step out of the classroom and have a tiny bit of a break before you dive back into your topic again. So you really do need to expect to spend an equal amount of time, whether it's reading, completing assignments, studying for your midterm exams, your exams, doing group work. So 18 hours of classes should really equal 18 hours of doing all of the other work that you need to in order to be successful. And coursework, again, as I mentioned, there'll be individual assignments, there'll be group work or projects, there'll be presentations where you might have to be up in front of the classroom. Of course, there'll be tests, and there'll also be exams. So let's talk a little bit about each semester. So in your first semester, whether you are the fall or the winter intake, these are the classes, and I'll go through and explain each one briefly for you. So I had mentioned a few slides ago about a course that's called Strategies for Student Success. And this particular course is excellent. First of all, it's offered in your first semester, right when you're brand new coming to this program at George Brown College. And in this course, you learn techniques and methods in order to be organized, and to have good time management skills. And really, that's the reason for the title. We are setting you up to have success within this program. For many people, whether you are coming to college for the first time, you are coming back as part of a second career, working towards that, or you've already been in all kinds of schooling and you're just continuing your education. It is a good reminder and a refresher for everyone on how to stay on track when you are studying any kind of curriculum at any school. And these are life skills that you could go on and use in your work life as well. A very important course, and you'll see we talk about it in several of the semesters, is Anatomy and Terminology. And this is Anatomy and Terminology 1. This is a very important course because obviously you are taking office administration in health services. So an important part of this is learning all of the medical terms and parts of the body, body systems, and procedures. It is kind of like learning a new language. And I have to say that although this particular course is very demanding, and some people, or actually most people, will tell you that it is pretty difficult. Almost all of the students that I have taught and that have come through this program have said that even though it is that, it remains one of their most favorite courses. It's truly fascinating. Another course that you will start in semester 1 is Tech and Info 1. And this is all about your computer skills. Okay, so you'll be having your introduction to that. Keyboarding 1 is another very important course. This is where you will be working on your keyboarding skills or your typing skills. So we will be looking for how fast you can type and also how accurate you are when you are typing. College English, as I had mentioned, it's one of the requirements. You must have grade 12 English to be able to apply for this program and be accepted. And then when you are coming into this program and you have been accepted, you will need to take a college English placement or an assessment test. And this will determine what area of English you will begin, whether it is the general or the advanced English. But either way, almost all of our students will be taking one of the Englishes in their first semester. Then from there, we have something called general elective. And you will see as we go through, electives are offered in all 4 semesters, and they are required. Electives are courses that are usually not associated with the actual program that you are learning in. So for example, some of the electives could be interesting topics like astronomy, photography, women in film, children's literature, art, psychology and art, all kinds of different things that you will have the opportunity to work on and learn. And they are what rounds out your semester's courses. So semester 2, whether you are winter or spring, you will have math, and it is foundational math, and I think it's comparable to, in many ways, what you might have taken, for some of you, in your grade 12 math course. So we don't go into a lot of the really complicated, I guess you would say, math. But it is an important topic when you are getting into healthcare. You do need to have that. You'll see anatomy and terminology 2. That course is continuing and it's building on the first semester. Tech and Info 2, again, your computer skills. It's building on the first course in semester 1. Then we have a course called Office Procedures. And this course is offered twice a week. So it's actually 4 hours broken up into 2 2-hour classes. And this particular course will introduce you to all kinds of things administratively working in a medical office environment. You'll learn about filing procedures. You will learn about patient scheduling and registering of patients. You will also learn a lot about interpersonal skills, whether they be written or actual communication, not only with the public and the patients, but also your colleagues and your employers. We spend a lot of time in this particular course working on soft skills, which are so important when you are working in the healthcare environment. Keyboarding 2 is a continuation from the first semester. And then we have another course that's brand new, very important, Intro to Healthcare Law. And this particular course is teaching you about all of the Canadian healthcare law that you need to know as you will be embarking on your career in healthcare. And there's that general elective again. And again, you're going to have a choice between several different subject matters. And that, again, will round out your semester 2 courses. So you will see as we go along, they're pretty full semesters. So semester 3, and that's when everybody starts back in the fall. The first course that's listed there is Bookkeeping for the Medical Environment. When people see this, they think immediately that it must be an accounting course. But it is not. This particular course does cover some basic accounting concepts for the first few weeks, but we also talk about many other topics that will involve subject matters including identity theft. We talk about purchase orders, inventory, because you might be actually ordering the supplies and the equipment for the healthcare environment that you're working in. We cover travel arrangements. We talk about all kinds of other things that involve administrative and also completing tasks working on your computer. In a way, this course is a continuation of the Office Procedures course from your second semester. The Clinical Environment course, this course spends a lot of time talking about health and safety in healthcare, which of course is so important, not only for the patients, but also for you. We will cover topics such as WHMIS, which is working with hazardous workplace materials. Some of you might be familiar with that already in your previous jobs. We talk about WSIB, so workplace safety, and we also talk a lot about infection control within the healthcare environment. Healthcare Documentation 1, you will learn in this course how to transcribe documents and how to create documents that are used in the healthcare environment. Health Insurance Billing 1, this is your introduction to the actual billing procedures that are done working in Ontario. So OHIP, essentially, you're going to be learning about that and how doctors bill for each of their patients after they have seen them and for the services that they have provided. Tech and Info 3, of course, there it is. It's a continuation from your first and second semester. And this semester, there's a large focus on the software Excel. And there again, Anatomy and Terminology 3, continuation of the first and second semester. As you move along in the textbook that you will be using, you will move from one body system to another, and also again be talking about all of the various types of procedures and learning all of the different terms and words that are used in the medical environment. And the last course for your third semester would again be another general elective. When you finally reach your fourth and final semester, you will see there is Healthcare Documentation 2, which is a continuation from your third semester course. Health Insurance Billing 2, also a continuation. And Tech and Info 4, and it is the Access database software that you will be learning in this semester. Career Launch is a course that essentially, I guess the name kind of says it all. It's really helping you prepare as you are heading towards the end of your final semester. It's getting you organized to think about where you're going career-wise. You learn about working with different types of people, group work, how to get along with others, how to present yourself when you are applying for a job and you're interviewing. So all the different types of tools and resources that you might want and need as you are preparing to embark on your new career. Keyboarding applications. There's a lot of coursework that is done using your computer, but this particular program is, course is focusing in on all kinds of topics. We talk about how to create professional emails in the work environment, and we talk about various other administrative practices that you would need when you were working in that line of work. In a sense, this course is a continuation of your Bookkeeping for the Medical Environment course. And then finally, there's the field placement, and that's what everybody wants to hear about. And I'll talk more about that in a moment. And oops, almost forgot, there's the general elective. You've got one more general elective that you have to complete. So that's a basic overview of all 4 semesters. And I hope that sounds interesting to all of you. So placement experiences. So as I mentioned, in 4th semester, the students in this program, they go on field placements. And this is a wonderful opportunity for them to be able to apply and expand on everything that they have actually learned in the classroom from their teachers and also other students as well, working together. You're going to gain professional and interpersonal skills as you find yourself immersed in various healthcare environments. So in order to qualify, though, for this placement experience, students must first be cleared, and they have to, of course, complete some work that has to be done by a company called Paramed. So there are medical requirements, and there's also a police check that must be completed. And this is a police check in the vulnerable sector because you could possibly be working with young children, depending on where you are placed for your placement and also for your future job. So this would be something that we would go into much more detail once you were a part of this program, and as the semesters went on, we do spend a lot of time talking about what this paramed process is. So placements in your fourth semester, typically they begin mid to end January and they go to early May. What we have been doing is we've been having students go 1 day a week in their fourth semester. And up to this point, it has either been on a Tuesday or a Thursday. At the end of this time, the students will then go for a 2-week full-time block. We're hoping for anywhere from 140 to 160 hours, but I believe it's now 140 hours that we are hoping the students will have completed. This is a combination of them attending their placement and also completing some coursework to go along with it. When you go to your placement, you could be somewhere where you are performing a lot of administrative tasks, so technical or hard skills, or you could be spending a large majority of your time at placement working with patients and clients and having to communicate and really work and actually use your soft skills. So how to get along with others, how to communicate, how to have empathy. And this is something that the students that have gone through this program find that they use quite a lot when they are at their placements. So placement sites are found for students, and they could include a variety of places. We've had students that have gone to do their placements in hospitals, so long-term care facilities. There's been walk-in clinics, solo practitioners, family practices, and placement sites are primarily within the Greater Toronto area. We are very open to any kinds of suggestions that students have. If they know of a place that might be willing to take on a George Brown student, we're always looking to expand our database of connections that we have within the healthcare community. We are affiliated with many large healthcare facilities, including the hospitals, so there's lots of opportunity for students to go to a variety of places and have a very valuable experience at their placement and be exposed to many different situations, and also, again, as I said, be able to utilize the hard skills and the soft skills that they have already learned in school. These are some of our placement partners. I just wanted to have this up here for you so you could take a look. So St. Michael's, as you can see, Mount Sinai. We have UHN, which is Toronto General and Western. We have North York General. I don't have included up here, but we have Michael Garon. There are also Centenary Hospital. There's a lot of hospitals that are affiliated with us. Another fantastic place that we've had much success over the years, Holland Bloorview Kids Rehabilitation Hospital and Mackenzie Health. They've been really, really great, as have all of the ones that are listed here and others. They've been great to all of our George Brown students and very, very supportive in helping the students learn as much as they can. So that's just to give you an overview and an idea about the different places you could go. But there's also many places that are maybe not as well known where students also get a very valuable and very hands-on experience working in healthcare. So as a graduate of this program, when you've gone through the 2 years, you really are going to become a vital part of a healthcare team. And this could be in a variety of positions. The type of job you're going into can be referred to in many different names. You might be considered a clerical assistant, an office administrator, a hospital unit clerk, an office manager, an executive secretary, and really the list goes on. There's so many different job titles that are out there. And George Brown graduates are really perceived out in the healthcare industry and by our placement partners and employers as being well prepared to work in the field. So you've chosen a good program to come to. We start teaching you about medical terminology and knowledge right from the first semester. You are immersed in the medical, the clinical field right from the get-go. So I had mentioned at the beginning of this presentation that my name is Mary Simmons. And again, I am faculty, full-time faculty, and I do teach in the program. I'm also the program coordinator. And what that means is that if you have any questions, you could reach out to me. There's my email, msimmons@georgebrown.ca. I can help you if you've got some general questions about the program, as well as once you are in the program, I'm here to assist with adding any courses to your program, dropping courses, timetable issues, anything like that. And then from a faculty standpoint, of course, as being your teacher, I'm here to help you out as you were learning in the courses that I teach in and anything else that you need as well. So that's a basic overview of our program, S135, Office Administration Health Services. I really hope that this short orientation and presentation has helped you get a bit more knowledge about our program. And I wish you the best of luck when you are applying for college. And I hope that I see many of you actually in our program. Really look forward to it. Thank you so much for taking the time to view this presentation. Thank you. Have a good day. Bye-bye.